After facing and overcoming great challenges during the COVID-19 pandemic, it is good to sit back and think about the lessons learned from COVID-19 and also other pandemics and how we can address communication challenges going forward. As such, here are the core elements of communication during a pandemic influenza. The first element is to maintain and build public trust in public health authorities. In the 1980s, the HIV/AIDS epidemic devastated the health system in Zimbabwe, increasing the prevalence of the disease and infecting a lot of first responders, which stopped a lot of people from receiving the treatment they needed when infected with HIV/AIDS. When cholera came, it worsened the shortages of medicine, essential equipment, and electricity outbreaks that led to a loss of confidence in the general population to treat other medical needs. So many residents chose not to seek treatment against cholera. Similarly, in Karachi, Pakistan, polio persists in the region because residents distrust the health system because of the neglect of other health services that they haven't gotten in the past. The second core element is to support coordination efforts to efficiently use resources. During the H1N1 influenza pandemic in Canada in 2009, there were strong levels of coordination among multiple levels of government and British Columbia to develop a comprehensive H1N1 action plan early in the outbreak. This included sending diagnostic kits to First Nation communities with Indigenous populations to expedite care, and as such, there was a lower number of hospitalization in these communities compared to others. This was far different from the response that we saw with Ebola in 2014 when the World Health Organization underestimated the complexity and magnitude of Ebola. The rapid cases outstripped the ability of aid groups, regional governments, and international health officials to bring it under control. As a result, the three countries hit hardest by Ebola were among the poorest in the world, with health systems and other infrastructures so decimated by civil war and conflict they were barely able to provide basic care. The third is that the government must be able to provide relevant public health information to the public. In Zimbabwe, the government restricted access to aid workers and journalists to stop broadcasting cholera outbreaks. They minimized disease surveillance, and because of this, it took 6 or 7 weeks before deaths were adequately accounted for because the government did not want UN agencies involved. More recently, during the COVID-19 pandemic, numerous claims about preventing the coronavirus stated that hydrochloroquine can prevent and cure COVID-19, and wearing masks and keeping people locked down have no value. The mixed messaging during the pandemic confused a lot of people, and they didn't know how to accurately protect themselves. Fourth, the government must take appropriate action for the health and safety of all communities. During the COVID-19 pandemic, first responders were active in procuring personal protective equipment for themselves and their teams. Efforts were deployed to make sure masks, gowns, gloves, and electrostatic sprays were available whenever needed. They installed thermal readers to read temperatures automatically and changed virtual meetings to minimize the risk of exposure to COVID-19.